Good morning. I'd like to call the July 27th Executive Committee meeting to order. First, I need a motion to allow 2 members that are away on business in the meeting. No more. Mr. Payton with first. Any second? I'd hate for it to die without a second. Oh. Mr. Fairfield. Oh, Mrs. Polk allowed. All right. Mr. Lear and Mr. Wheeler are joining us on Zoom today. So with that, roll call, please. I don't see him.
Mr. Hess. Present. Ms. Polk. Are we just present to let them in?
Yeah.
Okay. Ms. Weber.
Aye.
Mr. Payton.
Aye.
Ms. Parker.
Aye.
Mr. Kinzinger.
Aye.
Mr. Fairfield.
Aye.
Mr. Carrico.
Aye.
Mr. Featherling.
Aye.
Mr. Miller.
Aye.
Mr. Hunter.
Aye.
Mr. Searay.
Aye.
Motion carries.
Okay, welcome to the meeting, gentlemen. Now roll call for attendance.
Mr. Lear.
Present.
Mr. Hess.
Present.
Ms. Polk.
Present.
Ms. Weber.
Present.
Mr. Payton.
Present.
Ms. Parker.
Present.
Mr. Kinzinger.
Present.
Mr. Fairfield.
Present.
Mr. Carrico.
Present.
Mr. Featherling.
Present.
Mr. Miller.
Present.
Mr. Long. Mr. Hunter.
Present.
Mr. Wheeler.
He said present. I seen his mouth. You're muted, Andy.
Present.
Yeah. Lucky I can
Mr.
read lips.
Searay?
Present.
We have a quorum.
Thank you. Do I have any public comment? Do I have any public comment today? Any public comment? Seeing none, we'll move on to the approval of the June 22nd, 21 minutes. Motion to approve, Mrs. Parker, second by Mr. Hunter. All in favor with a voice vote, say aye.
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 All opposed? No, nothing opposed on Zoom. Okay, thank you. Minutes are passed. Any presentation? No presentations today. Moves us on to legislative. Mr. Lear, do you have anything on the legislative front?
Not at this point.
Thank you, sir. And moves us on to the American, what is it? The ARPA Subcommittee Reports, Policy Project, and/or funding recommendations, the adoption of policies for American Rescue Plan funding. That is in your packet, is basically the bold under the mission statements that the subcommittees came to an agreement with. If those are fine, I need a motion to accept. Mr. Miller and Mrs. Polk on Zoom. So do we have any discussion on those? I was not in attendance last week, so you guys that were, you can, if these are wrong, we can bring those up and we can make our changes if we have to.
Yeah,
oh, Mr. Hunter, hold on first. 13.
Ron first.
Go ahead.
Okay. Thank you, Mr. Chairman. If germane and within the confines of the ARPA funds, I would imagine that this administration would be amenable to additional items that clarify the use of the funds. Is that appropriate, or you can defer to
I
Mr.
think
Wheeler?
That's an appropriate statement. Yeah, I think that's an appropriate statement.
Thank you.
Mr. Kinzinger, do you have anything to add to that?
Yes.
Oh, hold on, sir. Thank you.
I'm pleading ignorance. On this mission statement, I just read through it. It appears that it's telling us how we are to approach the funds that have been given to us and the steps that we will take as a county.
Gives us kind of a guideline. It's not strict lines. You know, and this is the hardest thing that we're going to have to deal with, because we don't really have a road map, so to speak, that we have strict lines. We've got it broadens them so that the lines are as gray as they can appear, but as in line as they can appear.
Okay,
Mr. Wheeler, do you have a comment on that?
Well, the initial policies that we came up with allow us to be able to start funneling projects that we know have been requested of us into certain buckets. And then the process will produce other policies that will, as long as they're in line with the legal use of the funds, we will adopt at that subcommittee level and then bring back to this committee for final approval. So it's just the start, and it may broaden out as we go further, or as the law is further defined by Department of Treasury.
I like it. I read the mission statement, and I think the approach is correct. That's
Okay.
all. Thank you.
Anybody else, first time?
Mr. Chairman,
Yes, sir, Mr. Lear.
is the intention of this motion to adopt both the mission statement and the principles, or just the principles?
I think the whole page, Mr. Lear.
It was just the policies, actually. The mission statement was just, a lead into the first set of policies that we adopted at the committee level.
Have we adopted the mission statement yet? Should we not do that?
We could, yeah, that's fine. It wasn't adopted on the subcommittee level. Mr. Lear clarified that in the meetings, but if we would like to, that's fine.
If
Yeah.
Yeah, pardon me. Hold on. Mr. Hunter.
Yeah, with all due respect, Mr. Chairman and Mr. Wheeler, I want to call your attention to this sentence here, and it needs clarification, and I don't think it needs to be misconstrued. It says, considering municipalities receive their own allocations, the county will focus on the rural areas of the county. And it goes on. Let me be very candid about this. You guys have heard the chairman indicate that there will be collaboration with this body and local forms of government. So that somewhat, not necessarily negates, but there are organizations who have attended stakeholder meetings in the past, starting back in March of this year, who will be individuals and organizations who will be requesting the ARPA funds. So I just want to be very clear, in which this says that it will focus on rural areas. There'll be money spent within the local forms of government as well too. So no misunderstanding about that. In other words, there's going to be money given to the city of Kankakee organizations who are within the corporate confines of the city. There are other individuals outside of or at other villages and so forth, and their particular forms of government have received ARPA funds too, and they'll probably be getting ARPA funds as well too. So this does not mean that the ARPA funds will be just used in the rural areas. So
I agree. I think where partnerships are created and needed, we will consider those. Mr. Kinzinger?
Just clarification, Steve threw me for a loop. This mission statement says that the overarching principles that will guide, and it lists the 5 principles. Are we voting on things individually, or are we voting on this mission statement?
We're voting on this whole page.
Good.
This whole page.
It's good.
Okay, you like it?
Yeah, I like it.
All right, good. Any other discussion on this? And I understand Mr. Hunter's point where it could be read that that's the only thing we're spending the money on, where we're opening up to broadening that horizon to possible partnerships. We don't know of any partnerships right now, but of possible partnerships.
Well, you may, with all due respect, the chairman has met, for example, with the mayor of the city of Kankakee.
Yes.
And he's met with other heads of local governments as well too, which he should. And so I just want to make sure you guys and people who read this say all the money's going to the rural communities, and that's not what this thing is going to do.
I think anytime there's a vast amount of funds, we should always know what our neighbors are spending their money on and what we're spending our money on. I think that's just smart business too, so I agree. So I have a motion and a second. think we can go, well, let's go vote, roll call vote, because this could possibly lead to spending money someday.
Mr. Lear?
Aye.
Mr. Hess? Ms. Polk?
Aye.
Ms. Weber? Mr. Payton? Ms. Parker? Mr. Kinzinger?
Aye.
Mr. Fairfield? Mr. Carrico? Mr. Featherling? Mr. Miller? Mr. Hunter? Mr. Wheeler?
Aye.
Mr. Searoyd?
Aye.
Motion carries.
Thank you. Moving on to information services, Mr. Kevin Duvall. He's gonna tell us how great he's under budget. Good morning, Kevin.
Well, yes, we are on budget. I don't know about under budget, so we're doing okay. I'm really here for right now to ask if you have any questions about some of the projects that are going on. This is our busy time, but as I know the chairman brought up a project that you're all kind of probably interested in, which the iPads, we're on track with that. I'll need to have some additional conversation with the chairman because it needs to be implemented how the chairman says, because they have to be controlled items. We'll be handing them to you. I need to know to what degree that the chairman wants to have that happen, but they're really going to be tools for you to, my understanding of this, I want to be careful that I'm saying that, there will be tools for you to access your email and access the packets on the electronic documents so they don't have to pass them out as much and you'll always have them available to you. But because you'll be using them in this room and possibly other places, they have to be locked down other than that. So they're not your personal items, and since you'll be using them in meetings, we need to restrict what you can do on some of those because they're foilable things. So you can't just be out there doing what you personally would do on the internet because somebody could FOIA, and now there's a whole legal thing that was set out for the county. So we're really going to, as far as I know right now, Andy will be more specific for that once he's had time to think that through. We've had several conversations about that. So email access, you'll be able to read PDFs, you'll be able to share the files and like if Kelly is putting out packets for you, I perceive that you'll be able to get that through these. Now they're not, you will need to be near a Wi-Fi item, so the county isn't paying for you to have internet over them. And actually, we got them for free from, well, you paid for them, but you just paid for them a long time ago for the thing. So they will need to have Wi-Fi. We're not paying for internet for 28 board members, but there's almost no place that doesn't have Wi-Fi, and you'll be able to join Wi-Fi any place that you take them to, and there already will be reconfigured that you can go any place in this building and you will get the internet that we provide for you. That's as much as we've nailed down right now. We couldn't begin the process until you officially okayed it with the board. Once he did that, Dan gave them to me, and then we started the process to take them out in the voting process, which was not an easy thing to do because they were locked down hard. So once we figured that out and we moved forward, but they're sitting downstairs, and we'll be ready to go the next time or when Andy wants to proceed, when he has the procedure down and he feels comfortable with them. So,
Mr. Kinzinger?
Yes. Is it possible that this information can be, and you're way above my league, in a lockbox so that we could access those with our personal business computers and not use your iPad, for instance?
You are, from what I understand, none of you are, I want to be careful what I'm saying because I'm not the chairman. I want to make sure I'm not overstepping. I don't believe you will be obligated to use these iPads. And if you have iPads yourself that are newer than this, we could help you configure to access those things.
So we don't, okay, very good.
But I believe, and this is where I'm not sure with Andy, that they will stop the paper packets. I believe that's one of the main pushes here for it.
I think Mr. Hunter, by going digital, we'll not have to print out so many of these paper packets. Now, you can get those by request, I'm sure, but I think that's one of the purposes of going digital.
Well, that, and you don't have the labor that you had in the past, and I think this is a factor. I mean, Kelly's, she doesn't have enough time in the day to do these things, so anytime a new package comes, well, she already produces it, but then to go make 30 times copies per day, and then you lost them, and she's got to stop the thing. So this makes sense. And so it's there to give you a mechanism that if you don't have a mechanism, and I don't want to speak for Andy because I'm getting nervous here that I'm outside over the thing. I may be going too far. But I believe that's what Andy said to me. It's a mechanism so we can go digital completely. You'll actually get things faster because it'll be immediately there. You won't have to wait for it to come into the building to get. I believe that's where he's going. I'm looking at Andy in there, so yeah. I'm waiting for him to jump in.
Mrs. Weber, do you have a
Yes, we, at another meeting, we were told we'd get new email addresses. Is that correct?
I don't believe that's the case, but then again, that will be what Andy and I discuss. That's why I can only set them up so far, because it needs to be thought out. I'm sure he's consulting with state's attorney to make sure we know if we're handing a mechanism to you that we don't create a whole chain that says, all right, now you got more responsibility and all this stuff. The easy thing in my mind we're saying is we'll give you iPads. They'll be specific to you and your district. We will enter in the email that Andy approves, and that'll be your official way to access your email and the packets that they send to you. You'll be able to theoretically save there. The ability, what I have to do is set up remote software in the matter, which allows us, if you were ever to lose it, we can remote wipe it, or we can remote install, so you don't have to come into the building. Now, as far as whether or not you actually take them home, I believe that's yet to be.
Yeah, we haven't developed the policy yet for the whole electronic thing. Mr. Wheeler, do you have a comment on this?
Yes. First of all, the emails do not have to change. That's just the county clerk. That's the only one by law who has to change to the .gov, not us. So that doesn't apply. I'm trying to think what else. Oh, the intent was to people to take it home, take it wherever, because it's just county business that's going to be on there. It's not to be used for anything else. That's what Kevin was alluding to. One thing that Kevin doesn't know is we have a bunch of requests from departments for laptops. For like probation wants a few laptops to go out in the field. So he's looking down because he's probably anguishing that we're going to be asking for some of these to go to probation probably instead of buying new laptops. So there's more to go on this. We've got 28 for county board, maybe keep another half as many for backups, or the equal amount. But then we could use the rest of them in other departments to fulfill their requests. So,
well, and
because we got 130 of them, Kevin?
Yes, more than that. We didn't take possession of all of those right now, but we will. But for the other departments, they can't use them that way. They can find another mechanism to use it, but none of these will run apps that are in their departments. Because the world is on Windows. These are Apple products. So there would have to be some kind of reason that they would need them. I don't care what that is. If you want them, we can give them to you. But what I've concentrated is making sure that the fifth floor and the board is safe, and then we maximize how you can use them. What may end up doing, if Andy approves it, we may say we give 10 to probation, or but they wouldn't be able to use that to access court view, or anything, because that requires a different. I don't want to get into the weeds of operating system stuff, but it's not something. When they want a laptop, they actually want a laptop.
It's not compatible to what they want to use it for.
But there may be something you can find in between there. I like where Andy's going with that.
Mr. Featherling, sorry. Had the
Number 10.
tongue. Yeah, I got you, sir.
Okay.
Thank you.
So this is, I got into my truck and I'm on my way here and I stop and get something, I come out and it's gone. Who's responsible to pay for that? Me? Or
Well, the county.
I think we can track those.
You can track them?
Yeah, you can track them.
To a certain extent, because
So you know
again,
where I'm at all the
Yeah.
time.
they're not.
That's the only reason we're giving them to you.
No, there's certain things that you have, if they were your personal ones, that are turned off when we do them. We probably would be able to find the unit, but there's no human being sitting there trying to track you for that. As far as the legal responsibility, if you lose it, you won't be able to access it. It won't be that you can open this up. There's codes to get into it, and you really won't have that sensitive of data on there, because if we're emailing it to you, it's a public record.
Yeah, that's true.
At that point.
Yeah.
So.
Mrs. Parker.
Thank you, Mr. Chairman. I just have one question. Will Kelly still mail us the packet and where we can access it on our computer, or can because sometimes I like to just go in and print a few pages I have questions on. I don't know if I'll be able to print from the laptop, but if I have it on my home computer in the packet she sends, I can still print those pages out.
What I understand right now, and I'm gonna this is more conversations that Andy and I will have. This will be an additional way to access it, so you will not stop getting things how you're getting them now. It's just a universal way that you can access it, so they know if they're stopping the paperwork that they've provided you another means to get it. They're just not leaving you high and dry. I believe that's where Andy's going with that. But again, I don't want to speak too much.
I think this is all policy we're going to work through before we get assigned the iPads. There's a lot of different moving parts that could happen. Maybe they just all stay right there, you know, and you get on them right there. Then there's no worry about it. You know, it's all things we're going to have to work through to be the safest and securest, and for the device and yourselves protected. So
we have, at the end of the year, I have a stack of minutes and agendas and information that I have to, you know, destroy. And this is really going to be, you know, really healthy.
I light my grill with a lot of that stuff. Okay, moving. Anything else on the iPads, Mr. Hunter? Do you have something else to add?
Yeah, well, I don't know about adding. I'll just comment that, you know, as Mr. Duval has indicated, this is an ongoing process, and I'd like to see us kept up to date on that. Additionally, you know, I serve on the Karma board, and we have the iPads stationary, you know, to the desk. We don't take them home or anything. We got our agendas and all the stuff downloaded there. But sometimes I want a hard copy of the minutes as well as the graphs and all the stuff. I mean, it's like that. It's not, you know, as small as something like this. So, and that's why my affect, you know, jumped, my body language jumped when you said that, and I know Andy talked to me about this before, but I thought it was something in process, which it is, that they're going to stop, you know, paper documents. But you guys have also indicated that if we need it, we can get that.
That's where I want to be very careful that we haven't finalized it. So when I'm not speaking for the chairman, I'm telling you what part I know so far, and I said that we need to meet. And I'm going to go by what he says that he's researched and what he wants to implement. So I don't want to make it saying this is locked in. It's not locked in. This is what I know so far.
Right, because you know we have to refer back to what was done previously in order to make a point in the future or at a particular meeting, because I do read the documents, and when I come in here too, I'll take a look at them as well too. So thank you.
That's it.
Anything else for Kevin? Mr. Duval? Nothing. Have a great day, bud.
Thank you.
Next up, Health Department. Mr. Beavis. Again, we have no report or anything.
Good morning. First, I would like to apologize. I know that when I sent Kelly yesterday the report, it still has last month's date. So at the top it says the week of 6/16. It is the correct numbers underneath, but it should be reflective of yesterday's date, 7/26. So if you could just note that, otherwise you could confuse it with last month's numbers. So just real quick off those, our cases stand at 14,859 positive cases in Kankakee County. From last month, that's an additional 197. That's an average of 6 a day, so we are seeing reduced numbers of positive cases. Last month, we had 236 deaths in June, and we're up to 243, so that's an additional 7 deaths, unfortunately. And then our recoveries are up 181. We're now sitting at 14,462. The region positivity rate right now for Region 7, which is Kankakee and Will County, if you remember, is sitting at 3.3. That has slowly crept up in the last month. However, the good news is last month, Kankakee was at 2.3 on its own, and Will County was at 1.2. Those numbers have almost reversed. We're at 1.4, so we're holding pretty good there with our positivity rate. And so far this week, it's looking about the same. Will County's has crept up to the 3.6. So obviously, their population is sitting at 700,000. They drive the bus, so to speak, with the population because they have 6 people to every one of ours, and it's hard for us to compete with those numbers. So right now in our county, we are doing pretty well with the positivity rate and our positive cases. The fully vaccinated right now has jumped up to 40,000, just a little over 40,035. That's almost 5,000 more than last month. So we are continuing to get people vaccinated throughout the county. And last month, our fully vaccinated rate was 32.4. We're at 36.4 as of yesterday. So we'll go over that. So that's a 4% jump. And again, now it's just going to be little incremental jumps as we go. We're not seeing the numbers at the clinics, that we were early on. We have a large percentage of the population that's vaccinated, and then we're just trying to convince those that aren't yet to, come in and get their vaccinations. And then obviously we do have a number of individuals who are not officially yet eligible to get vaccines because there's just not a vaccine available for them yet per their age, the 12 and unders.
Mr. Beavis, can I stop you there for a second? Because that was a discussion earlier before the meeting. How many individuals are not eligible out of our total population number? Because it kind of, figures lie and liars figure sometimes. So you can sometimes skew the numbers by not knowing the amount of people in the whole number that's not eligible for the vaccine that we're doing the percentage on.
I am sorry, I don't have that exact number for you now.
You understand our points?
I do understand the question. It's a very good question. What I can tell you is that the population of 18 and under is the largest group of population within the county.
Okay.
So, but the exact number of that, I don't have. I could get that number. If I'd have known ahead of time, I could have, kind of come in with a rough guesstimate. But
no, maybe
the two biggest subset populations in our county of the 110,000 that we have, the biggest group is the 18 and unders, and the second group is the 65 and overs. So that does, obviously, until there's another vaccine available for the 12 and unders, which, rumor is that they are out there preparing one. We just don't know when it'll be available, and we don't know who it'll be. But that is something that is being worked on, and then that would be another subset of population that those parents then would be able to bring those children in and to get them vaccinated. And maybe then get some additional parents that haven't been vaccinated. Maybe that's what they're waiting for, the convenience of that.
So in actuality, we could be over the 36% of eligible people to get the vaccination. We could be closer to 70%.
Exactly, and that is where sometimes the governor will give you numbers of total vaccinated per eligible, but the numbers that they go off of for all the counties is fully vaccinated on your whole population, which includes uneligible individuals. So again, you're right. The numbers can be skewed or changed to reflect your argument. This is fully vaccinated for eligible, which is 18 and over, except for the Pfizer now that we do have a number of the 12 to 18s that have gotten vaccinated.
Thank you. Thank you. Any questions on that, Mr. Hunter? I know you can't let that lie.
We were talking before the meeting, as the chairman has indicated, and that's why I hollered at you, because that was didn't want to blindside you, but that could probably be another subset, number 7, next meeting. This is a question I have, and I know that the National Guard has been in and so forth and doing certain things. Public Health has been in. Other local entities are doing things. What I was concerned about, not necessarily concerned, are you meeting with large employers such as Shapiro? I know you've had the National Guard out there, you and Andy and Senator Joyce that were involved in that. Had you thought about making a presentation at the Economic Alliance, which is has all the CEOs at the banks, factories, industry, labor unions, and all that stuff in terms of what they need to do? Because I know some employers are mandating that their employees receive the vaccinations. Might that help?
That's definitely a good suggestion. Specifically, the answer would be, at this point, as of today, no, I have not met with the Economic Alliance or specifically reached out in regards to making some sort of a presentation. I do know that early on, when the vaccines first became available, we had put up that survey on our website and on the Facebook in regards for individuals to then start signing up and indicating, what group did you fall in? Were you 65 and older? Were you vulnerable population? Were you under 65? So that we could start to prioritize who to call, when those vaccines were available for those groups. And we also set up then a mechanism for the businesses, large to small, to contact us. And then we were working with some of the federally supported organizations, such as some of the pharmacies, and then some other organizations were coming in and vaccinating through the back door, so to speak. So we were vaccinating individuals off our list. Jewel Osco was one of the main ones that was going out there. Then we would feed them a number of our businesses, and they would contact and go out and schedule, such as a CSL, the ASF, and those types of things. To date, we're not getting any more of those phone calls from individuals. It appears that either their staffs or employees have been getting vaccinated, or now with so much vaccine available pretty much wherever you go down the corner through your local pharmacy or at the health department or to the hospitals, it's available for anyone to get, and we don't now have to go and they're not contacting us to get those shots.
Right, and to piggyback on my previous comments, this is macro. Your report is macro in terms of providing all the outlets for the vaccination, so people cannot say they don't know where to get their vaccinations unless they're living under a rock. But this is very comprehensive in terms of where they can go. Another point, hopefully this is the last time we have to deal with this stuff, but the variant evolves. But the utility companies, everybody gets a bill, I assume, from the utility companies, and that may be something you can work out in the future.
Okay, thank you. And just for a quick outreach that's coming up this weekend, July 31st, we are going to have two what we hope will be larger vaccination events. We are trying to accommodate back to school, so we were able to get BBCHS has agreed to host one of the locations, and then Moments High School will be hosting the other location. So we're kind of splitting up into two teams on the same day at the same time, so so this Saturday, July 31st from 9 to 12. We're going to have 2 teams set up. It's geared towards, trying to get as many of the youth, 12 to 18, vaccinated. Any of the adults that come along that aren't vaccinated can also get vaccinated. It's not just for those students and their parents. It's anybody can come to those locations at the Bradley site and or the Moment site. You don't just have to be those residents. It's open for everybody. They're graciously opening their doors. So this is an opportunity to try to get everybody, but those who are getting ready to go to school in high school, if they're wanting to not have to wear the masks, if that's how the policies are going to be set up within these schools, because you're vaccinated, here's your opportunity. If you're in sports or in band and some of these other things where if somebody next to you tests positive and you don't want to have to be quarantined, if you're vaccinated, then, last year I would be out, he would be out, but now if he's out, I don't have to be out, because I'm vaccinated. So these are those opportunities for individuals. And then obviously we'll have, nurses there who can answer any questions for people that are still on the fence and concerned about that, but that will be this Saturday. And then the second shot, because it's going to be Pfizer and J&J, and then the second shot will be August 21st at those same locations.
That's on your website?
Yes, it's on the Facebook, it's on our website. I need to also say that Mr. Milner with WVLI and his other stations has graciously volunteered to sort of sponsor along with that. So they're going to be doing some radio ads to help facilitate, getting the news out for that.
Thank you. Mr. Featherling.
Yeah. Thanks, John. If I was in a room with somebody who had COVID and I had some spores in my nose and I broke my leg and I go to Riverside, they test you, obviously, they test everybody that comes into the hospital. Would I test positive if I had just the cells or the spores, I think they call it, right? Is that the right word to use? Is it like a MRSA situation?
Through your hypothetical situation,
it's not hypothetical. I'm saying there could be a whole bunch of these positive cases, the people that just happen to have it in their nose. Is that true?
I don't know.
When they stick the Q-tip in your nose and pull it out, you might have it on it, but it might not be bothering you. You might not be sick.
It is possible to get COVID a second time, or to get COVID even if you're vaccinated.
Sure.
So it's a virus.
It's not as bad, and
so it's yes, exactly. Your serious illnesses, hospitalizations, and death are near none if you're vaccinated versus not being vaccinated, especially with the Delta variant that's out there today.
You hear people that are testing positive and they're going on quarantine they're fine, sitting at home for 2 weeks.
But if they're not, well, then those individuals sound like they would be not vaccinated, because if you're vaccinated, you don't have to, as long as you're asymptomatic.
Okay.
Correct.
No fever, no.
Correct.
Any
all the symptoms, correct.
Okay. Thank you. That was my question. Thank you.
Anything else for Mr. Beavis or Mr. Carrico?
Thank you, Mr. Chairman. John, during the Board of Health meeting, I asked you that question. I was not sure if you were going to put it there, but since you put it on the bottom of your first page that Delta variant is present in Kankakee County, and I asked you that question during the meeting. But before I ask you the question, I see here that you stated that Kankakee County percentage has gone down, and we have about fully vaccinated 36.9%, which make us to have unvaccinated approximately 63.5% of individuals. So my question will be, since you stated at the bottom the Delta variant is present in Kankakee County, do we have a number of cases among vaccinated and unvaccinated individuals in the county that been positive for Delta?
I asked my CD nurse that question recently. So when you first asked the question at the Board of Health meeting last month, I did not have this information. Since then, in talking with her and last week, the state, in its infinite wisdom, this is what they'll do sometimes. They do a dump of information, so it isn't just trickling in every day. Here's one, here's one. Sometimes it'll be weeks, and then all of a sudden, here's a bunch. And so they dumped in what I believe is at least 17 cases of Delta within our county. Now, please understand, and if I'm saying this correctly, everybody who goes and gets a COVID test is not having that test analyzed to determine if it's Delta or not. The labs that collect those samples are required to submit, I believe, a certain percentage of what they collect to then be tested for Delta or the other variants. So statistically, what we're hearing is that 80% of all the specimens, not just in Kankakee County, but in Illinois, that are being sampled for Delta are coming up positive. So Delta is present in Illinois. It is present in Kankakee County. If you're vaccinated, the vaccines are supposed to be protective and better protective for that versus anyone who's not vaccinated. So that is the education that we're trying to get out there now, that 90+%, and it might even be 95 and more percent, of individuals who are hospitalized or dying currently are all unvaccinated individuals. So last year it was everybody was an unvaccinated individual.
So let's say, for an instance, you're saying that 17 cases approximately with the Delta variant.
That's that we know of.
Okay. So do you know among those 17 cases, they're all unvaccinated individuals, or?
I don't know that. We don't get that breakdown of information specifically. That it's information that we get from the Illinois Department of Public Health in regards to their communicable disease section. So they're letting us know then that these individuals, and then based upon our contact tracing, there would have to be it's called a breakthrough investigation to then determine, you know, is that an individual who's had COVID before or not had COVID? And as I said, 83% are. Well, I lost my train of thought on that.
Sorry, I got your spot here.
Did that answer your question?
Yes, thank you.
All right, any other questions for Mr. Beavis? Because I let him get back to his report because we're down at the total population, down at...
Well, I'm not going to insult everybody's intelligence by necessarily repeating all this. It was kind of there, and if it sparked some questions, which it did on the Delta, Mr. Hunter asked the question, you know, obviously about eligible individuals, where we're at with that. So, and then the other information has traditionally been there from month to month in regards to who's got the vaccine, where it's at, and then I just updated you on kind of in the very near future. You know, obviously the big thing for us that we're working on is going to be in the next month, when schools begin to start up, all the different schools developing all their different interpretations of their policies for whether they're going to mask up or not mask up, or ask their parents, make it up to the parents to decide who's going to wear a mask or not, and how they're going to verify who or isn't, you know, fully vaccinated. I just, you know, it's difficult, and we had this issue last year with the restaurants, when the health department was asked to go in and be the mask police, so to speak, when the language was should wear a mask, and that's what CDC's recommendations are here for the schools, is should wear a mask if you're fully vaccinated, and then that all gets down to how are you going to prove you are or you aren't, and if you're just going to accept people's words, then that's where we're at. But we'll have to be monitoring, obviously, our COVID numbers in the next month and a half and 2 months as we start to get those populations back into the classrooms. And, you know, obviously we know what happened last fall. When that happened, we had the big surge. However, again, we didn't have vaccines available then. We've got more body armor on, so to speak, now, where we do have 40% of eligible, almost 40% of eligible individuals who can get vaccinated. And as we open up the door for some new vaccines that can go to lower ages, you know, we'll be able to get more and hopefully get to that herd immunity that they all talk about.
Perfect. Thank you, Mr.
Anybody
Beavis.
On
any comments on Zoom? Questions? Any other questions for Mr. Beavis? Seeing none, sir.
Thank you very much.
Have a great day.
All right.
Next up is the VAC. Can I get a motion to approve their monthly report, Mr. Payton and Mr. Featherling? With a second, all in favor, say aye.
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 Ms. Stansky?
I'm here if anybody has questions.
Number 18.
Oh, yep.
I'm going. I was hallway stalking.
Yeah, that's awesome.
Here
Thank
this
you.
Morning. So I just want to thank you all. We've had some great support from the board. We actually had someone find us a lift chair for a veteran that needed a lift chair, so that was fantastic. I also want to make sure to point out on the cover report that one of the nonprofits that I work with, Heroes, Hogs, and Hot Rods, is having a mental health and veteran resource fair along with a barbecue competition, strongman competition, and vendors August 14th in Mantino. And I appreciate any support that you guys can give for that. If any of you work with any mental health associations, organizations, feel free to stop by. We'll make sure that you have booth space. And I think that's it.
Thank you. Any questions for Ms. Smatansky? I'm trying.
It's all good.
Nothing? Thank you.
You're welcome.
County Administrator, Sunita Speckman. Monthly update. We got nothing. What are we approving in her? Is that down the way?
Yeah.
For your Department of Revenue thing?
Correct.
Okay. I'll wait till you talk about it.
Excellent. Yeah, I'll
Yeah.
quote you. Good morning. And what I have for you today is some specific pages out of the Blue Cross Blue Shield reports. The last report we had was in February, and it was through January 31st, the numbers. So I wanted to kind of talk through the information is that we're getting now isn't exactly positive. We are seeing some dramatic increases in our health insurance usage and costs, and so I wanted to talk through that. We are mostly because right now we're looking at getting our renewal numbers, and we task our consultant to have renewal numbers to us by mid-August, which would mean the latest numbers they're using would be June 30th. So this report is as of May. I don't have June's report yet. So what we're looking at is some increased usage, and I wanted to talk through that. I don't have any indication so far what our renewal numbers will be. However, the trend here as we talk through it is increasing, so I suspect an increase in premiums. So the first page you've got there is page 6. I just made copies. Each of these reports, there's 2 reports cited in here. Each of them are 20 pages long. They're available in my office if you'd like to see more detail. However, I picked out 4 pages of each and put them in here. So the first one, in this financial overview, if you look at like that mid-January 21 through May 2021 cost, and you go down to medical paid, $1,975,963. That's an average monthly cost of $395,000 about that the insurance company is paying out. A year ago, yeah, it should have been given to everybody. Do you have this?
Does anybody else need a? Apologize, Mr. Miller.
Thank you.
No.
As opposed to May 2021, 375,000, and that January report was 344,000. So we're talking an extra $50,000 a month that we've ticked up just since January. So there are increasing costs. If you look at the out-of-pocket number, that's kind of in the middle of that big thing, that big line of different numbers. The out-of-pocket number is the amount our employees are paying. So in addition to costing the county or looking at our renewal numbers more, our employees are paying more. So you can see the January 20 through May 20 a year ago, the out-of-pocket was $308,000, and the average now is $439,000. So on average, an extra $26,000 a month our employees are paying for their costs. So it costs our employees more, and it costs the insurance company more. The year-over-year trend down at the bottom, the 5-month trend, you can see the first one is 148% increase in costs year over year. Moving on to the next page, you can really see it here when it's this trend, which is a chart over time, which is the way I kind of like to look at things. The last one, when we looked in January, we had at that time about a 4% or 4-month trend of increased costs over 100%. So in other words, if you look at that loss ratio is the last column on the right side. If it's over 100%, what's happening is Blue Cross Blue Shield is paying out more in costs than they are receiving in our premiums. So we can surmise what's going to happen at renewal. So our concern in January was, is this trend going to continue? And yes, it has. And over the 12 months average, it's at 107%.
I could interrupt you there, Ms. Speckman. Could the trends be going up because people are more, how would I say that? People are more not in fear of going to the hospital or going to the doctor like they were in 2020?
Well, and we're gonna.
Is that reflective in your report someplace, or?
I'm not necessarily. I will say this. And it's at the back, so I can just speak to it now. But remember in January or in February when I was here, we had what's called high-cost claimants. We had 9 high-cost claimants. And that's when somebody has over $50,000 in costs related to their claim. Well, it's now 14.
Okay. So that answers my question.
So we have more seriously ill people. And when we get to the very last page, I want to talk about preventative care, because what we're seeing is a higher percentage of our employees going for routine annual exams and getting their cancer screenings, which is great news. Our employees are taking the right precautions to maintain their health. That's what we want to see. It results in less serious cases. Hopefully, typically, you would see as a percentage less serious cases if people are having their routine screenings. But what we have right now are 14 seriously ill claimants in our group, which is, and I guess I'll just ignore the pages and speak to it because I'm all over the board here.
Sorry.
But that is 1.57% of our total members, which is right at the benchmark, which is what you anticipate. So what we're not seeing is that the number of high-cost claimants is higher than what Blue Cross Blue Shield expects. The costs, the medical costs of our group are greater than what the benchmark is from Blue Cross Blue Shield. That's what we're seeing. Not necessarily the number of people. We're doing the right things, preventative care. We have exactly what they expect in terms of serious illnesses, but the costs are higher. And much, much higher than they were a year ago.
I know we're not waiting to, is that because those 14 that you were talking about, Anita, they're older population or what?
I would say they're across the board.
Okay.
Yeah.
Is it, okay.
Mr. Chairman?
Yes, sir.
If I could. Since we're not self-insured, we don't have specific demographic information on any of our claimants.
No, we don't.
If you're self-insured, you get the specific claims, but if we're fully insured, so you don't get that information on, what the conditions are across the board.
We do.
It's just not
for high-cost claimants, they tell me exactly, and I'll tell you, these ill employees, I talk to on the FMLA side as well. Most typically, those are the people that I'm speaking with on a regular basis.
I wanted to finish that. Are you going to ask ask for any RFPs, or are we just gonna go with them?
Well, and that will be tomorrow. Our consultant will be here, and because they are asking for a renewal of the contract for our consultant, but that's what we pay our consultant to do, and he typically every year asks for other.
Yeah.
And he'll give us, you know, we'll see then what when he presents, which won't be until the end of August probably, what the renewals are based on what he gets for the renewal, etc. In all likelihood, as soon as, before we even see the numbers, he starts going out to market. But that's what the consultant does for us, so that we don't need to do that.
Yeah, that's what I'm saying.
Yeah.
Mr. Rogers.
Thank you, Chairman. Going back to what Mr. Seroy said,
it's okay.
2020, all the selective surgeries were put off. Hip replacement, knee replacement, shoulders, whatever.
Mm-hmm.
Do you have a breakdown on how many more of those were done for the cost-wise? Because that also affects the cost of the employee.
Well, I suspect, I mean, again, if you think about a hip replacement or a knee replacement or whatever, I have a list of the claims over $50,000. So I know exactly what each of those claims is in for. I'll say that, I have it here in this report. It doesn't, I don't see that as being an astronomical amount, astronomical percentage. I will tell you mostly what I see is cancer in the serious.
I would say, Mr. Hess, that probably adds to it, but it's probably not the iceberg.
Right.
That we're dealing with.
And we have a work group that is aging.
Yeah.
I hate to say it because
We all are.
I'm right
every
there.
minute. Every minute. Any other, sorry.
No, I don't know. You know, the lag report I find very interesting just because I'm an accountant and I like to see numbers in a chart. It's my favorite thing. But that's on what's called page 13. But you can see there how the difference is in, and what I like seeing is they tell you what they're paying and what the date of the claim is. So it looks like this, it's about the 4th page in. Yes. So if you look at those first 9 months of that 12-month trend, that average per month is $313,000 worth of costs. The last 3 months is $432,000. Going on to the utilization report, so there's a little break and there's a different page, but there's an executive summary page. Here's where you're seeing a little bit of information on those high cost claims. So, Mr. Hess, down at the bottom, the lower left-hand side or right-hand side down here, you'll see where it says neoplasms, that's cancer treatment. So you can see musculoskeletal, bone diseases, hip replacements, things like that. Second.
This is the kind of stuff I like to see. Really, I don't want to.
But it does, I may not like the numbers, but it does help explain what's happening. And then if we, the last page, the rest of the stuff I've kind of already covered just anecdotally, but if you look at that last page, I did put the preventative care because I think that is a good trend. So November 2019 through October 2020, 29% of our employees were getting cervical cancer. The benchmark was 26, and now you can see we're at 34%. Great. Colon cancer, we were at 12.6. We're still at 12.6. Yeah, Mammogram screening, that's a great one. We're at 50%. Good. We need to be getting the screenings. Our employees need to be getting the screenings. The earlier we catch these, the better outcome for everybody. So.
True.
ER visits, I looked at ER visits thinking I would maybe see an uptick based on COVID, and I really didn't. The prior report 5 months ago, we had 81 total visits over 12 months, 13 were multiple times, so the same person went back multiple times. Right now we're at 96 total visits, 19 multiple times. So any other questions about the reports at all, the data? Like I said, this is from 2 different reports. I have 40 pages of data in my office if you'd like to see it.
I appreciate the information you brought forth.
The renewal is due, as I mentioned, mid-August. So we're probably looking at these numbers as the basis for our renewal. In fact, the insurance company has already requested our census, which is all the information on all of our members and their dependents and everything from their zip code to their age to their sex. So we'll be working on that within the next week or so.
Any questions about the report?
Next, the other thing we have to discuss today is the Illinois Department of Revenue, the COLA increase for the state's attorney, which we are required to give. You can see that's a separate sheet. It's one sheet. It should be in your packet.
So it's mandatory.
It is if you want to receive the reimbursement from the state for 90% of his costs, so yes.
Motion to
You
accept?
don't need
a motion?
You don't need a motion on that one. The one I want to talk about is the public defender.
Okay.
That is the one we need a motion on.
All right.
So the issue is that the public defender's salary, full-time salary, in order to receive the state reimbursement, must be 90% of the state's attorney. So with the state's attorney salary increasing to $178,960, what we need to do is increase, and you'll see it down at the bottom, it's kind of written in there. We need to increase the public defender salary to $161,064.16. We must have a motion, and there's a P-tax form that's included there that needs to be completed as well. So we need a motion and a resolution in order to make that happen.
Mr. Hunter, would you like to make that motion?
Yes, sir, Mr. Chairman.
Do we have a second?
I'll second.
Mrs. Polk seconds on Zoom. Any other discussion with that? Any questions? It's kind of the same every time the state's attorney gets a raise,
Right.
the public defender gets a raise.
Right.
Otherwise, you're not
Right.
treating both sides the same. Makes sense, doesn't it?
Right.
Okay. Roll call vote, please.
Mr. Lear?
Aye.
Mr. Hess?
Aye.
Ms. Polk?
Aye.
Ms. Weber? Mr. Payton? Ms. Parker? Mr. Kinzinger? Mr. Fairfield? Mr. Carrico? Mr. Featherling? Mr. Miller? Mr. Hunter? Mr. Wheeler?
Aye.
Mr. Searoy?
Aye.
Motion carries.
And that's all I have unless someone's got questions. Okay.
Oh, Mr. Hess.
Is this a typo down here because it says effective 7/1 of 2020?
It should be 2021.
Yeah, that's what duly noted in my motion.
Thank you, sir.
Not sure
Mrs.
where
Weber.
that is.
I'm again confused about, there's one in our packet and another one, which is which? There's the one,
Well-
one is dated 7/1/2021 and the other is dated 7/1/2020. The one dated 7/1/2020 is the one with the big money on it, and the one
In the packet. I think it's just the same. I glanced at it.
I didn't even look at my packet. I have my own sheets.
The one in the packet is dated,
The one dated 2021 would be correct.
but it doesn't have the right numbers on it.
So,
It has, has the one in the packet are correct, the one on our desk was not.
correct.
Okay.
Correct.
So the number that we approved was 178,960 is the current salary?
Well, it should be, this is, you're right, I read from the wrong report, 183,434. And the public defender, that's the state's attorney.
Right.
So that the public defender has to be 165,090,76.
And I don't think that was the motion.
No,
Is it included in the motion?
Let the motion, hold on, Mr. Hunter, there you go. Now you can.
Thank you. Let me just withdraw my motion, and I was under the impression we were voting on the one in the packet as opposed to, you referenced this, but I was looking at
Me
the
too.
packet, so.
I
Okay,
apologize for that, that's me,
183,434.18 and 165,090.76.
right.
that's the
Right.
one.
Right.
So, Mrs. Weber, would you like to make that motion to accept that one?
That's,
And then, Mr. Hunter, would you like to second that?
well, that's what I was voting on.
Okay.
Whatever.
Which one, I know we've got two different ones, so you can throw the one, or crumple the one up that says 178 at the end of the salary. That one's not any good. That's how you fix that. And then,
I'm sorry,
this
I
one
apologize.
This one is a 2.5 increase instead of 2.7. Okay, so that's where we're at. That's the one on the floor that needs a motion. If anybody would care to, Mrs. Weber would like to make that motion. Mr. Hunter would second it. Okay, now roll call vote. We got that cleared up.
Mr. Lear?
Aye.
Mr. Hess? Ms. Polk?
Aye.
Ms. Weber? Mr. Payton? Ms. Parker? Mr. Kinzinger? Mr. Fairfield? Mr. Carrico? Mr. Featherling? Mr. Miller? Mr. Hunter? Mr. Wheeler?
Aye.
Mr. Searay?
Aye.
Motion carries.
Thank you.
Now you got a resolution now?
The resolution will be available at the full board, you'll vote on that, that'll be included. Now that we have a motion, then we'll have the resolution
Generate a
drafted.
resolution.
Right.
Anything else for Mrs. Beck?
No, unless there's something for me.
No? All right. Have a great day.
Thank you.
Okay. Moving on, appointments, reappointments, and resignations. Seems Mr. Wheeler always gives me the fun names, and I apologize ahead of time. Reappointment of Jeffrey Long to the Kankakee County Board of Health. Reappointment of Dr. Olatunji Ekantilo to the Kankakee Board of Health. I apologize, sir, if I mispronounced that. I probably did. And reappointment of Dr. Sarita Jones to the Kankakee Board of Health. An appointment of Matthew Oshesky to the Regional Land Bank. Have a motion and a second.
Motion to approve those appointments in Moss.
Polk.
Motion, Mr. Hunter and Mrs. Polk. All in favor say aye.
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 Do you want a roll call, sir?
Yeah.
You request a roll call?
Yeah.
I think it's just a voice vote, but we can give a roll call.
Mr. Lear?
It's appointments.
Aye.
Mr. Hess? Ms. Polk?
Aye.
Ms. Weber? Mr. Payton? Ms. Parker? Mr. Kinzinger? Mr. Fairfield? Mr. Carrico? Mr. Featherling? Mr. Miller? Mr. Hunter?
Aye.
Mr. Wheeler?
Aye.
Mr. Searay?
Aye.
Motion carries.
Thank you. We have openings, 2 openings in the Kankakee Regional Land Bank Authority Board of Directors, 1 opening on the Raymond Drainage District, 1 opening on the Spring Hill Drainage District, 1 opening on the Caravan Drainage District, 1 opening on the Gar Creek Drainage District, 1 opening on the Little Beaver Special Drainage District, 1 opening on the McGilvray Special Drainage District, 1 opening on the Minnie Creek Drainage District, 1 opening on the Moments and Yellowhead Drainage District, number 1, 1 opening on the Essex Township Fire Protection District, 1 opening on the Zoning Board of Appeals, 1 opening on the Kankakee County Public Building Commission, 3 openings on the Manteno Number 9 Drainage District, 6 openings on the Kankakee County Regional Planning Commission, 8 openings on the Animal Welfare Advisory Committee, 1 veterinarian, 2 county board members, and 5 at-large members. Those applications can be found on the county administrator's website, I believe. There's a link to find that, and you can submit those. Any questions about that? Comments? On to new business. I have in your packet a proclamation honoring the outstanding achievement and dedication of Illinois Conservation Police Officer John Louis Farber. That will be going to the full board. He was named the, Mr. Hess, go ahead.
Make a motion.
Make a motion to approve it. Second by Mrs. Parker. All in favor say aye.
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 That'll move to the full board. Thank you. And amending the county code to clarify electronic attendance at county meetings. Now, I believe there's something in here or in this resolution that does not say, and let's look at it. Mr. Hunter, you're good for helping me out looking at these things.
Let me take a look at this.
It doesn't say anything. We want this to be used, but not if you got the sniffles or if you got a cold that day, you're just absent. You don't always have to zoom in. So I think we need to change some language here. There's nothing in there about long-term. Time.
This is going to have to be voted upon by the
full board.
So
it's, if we need to make any changes, let's make them now. Mr. Wheeler, do you have a comment on these?
Yes, I had asked the state's attorney to prepare a resolution that put in it that, because the intent when we originally passed this and we talked about it in the meetings was for mid to long-term absences, things like, for an example of, a rehab from a knee surgery or something like that. And so we just wanted to clarify it. For some reason, it wasn't inserted in here. So that was the intent of it. So that's the motion that I would ask to be made is to clarify mid to long term, and so it's just you're not wanting to zoom in because you got a cold. We all have to do that. The miss a meeting here and there. So that was the intent.
So seeing the state's attorney in the room here, maybe we can get them to add to
John?
Oh, gotcha. This is a reference, and we're going to prepare the correct one for the full.
We're preparing the final resolution.
Thank you, sir. Thank you. Okay.
Right.
Yes. So this is kind of what it's going to look like, and we'll vote on this at the full board. Okay. When we get the.
Well, you need to decide what you're going to put in it, Mr. Chairman. I'm sorry. If I could.
Sure. And with the state's attorneys in the room, with the state's attorneys in the room, they've heard your comment, Mr. Wheeler, and they're preparing the correct resolution. So, do you have any specific wording you want inserted someplace?
Well, this committee would need to approve the wording, and I just suggested mid to long-term absences.
Okay.
And let that be defined in the meetings by the board as what that's considered.
Andy, that's what you're recommending, and I'm sure the state's attorney's office will incorporate those the language that you're asking for, and that's fine. But we need to see all the specificity of that actual document with the language that we'll vote on in August. Is that fair?
Well, in order for us to follow our county's code, we have to approve something in committee before it goes to full board unless it's an emergency. So if you don't agree on the language in this meeting, I'll have to come back next month to executive committee. The intent was to go through it all in this meeting as we're doing now.
Okay. So what you're saying, and John, I want you to respond to this, the language that that Andy had indicated, is that fitting and proper for this resolution? And that should be okay? That should be sufficient?
Yeah, would you please go to the mic to answer that?
Mr. Chairman.
Mrs. Weber, hold on a second, Mr. Lear. Mrs. Weber?
If that's the only, if
Yes.
that's the only language that we're putting in long-term, then.
Mid and long-term
Mid and long-term, then.
illness.
Today's 2 persons would not be in that perimeter.
Well, I don't.
Actually, Mr. Chairman, can I answer that?
Yes, you can.
In our ordinance that we adopted, if you're away on county business, you're exempt.
Okay.
You can zoom into the meeting if you're away on county business. So yes, we would be available.
Okay, so
And if you have a personal emergency, and there are other exemptions that are listed in the ordinance.
So we're not changing those already there, we're just adding these
No.
things. Thank you.
That's it. We're just adding mid to long term to
Okay,
the ordinance.
That's good.
That's cool, then, I'll make that
Yeah,
motion.
John?
We had put the, actually Terry put the language in as we thought it was appropriate. There've been changes, there were some changes made in it. If the board decides that they want to change it and amend something going forward, that's fine, but the language that we put in was what we thought was appropriate.
Okay, thank you.
Okay.
So, Mr. Hunter, you gonna make the motion?
Yeah, but to be very clear, we're incorporating the comments that Andy mentioned, and you already have the comments already in this document or the future document?
No, it's going to, we have to put it in the future.
Okay.
Okay, so you're gonna make the motion to accept this document currently with the amendments made for the full board.
Okay, let me be clear before I move this. We're incorporating the comments of Chairman Wheeler and the comments of the state's attorney. We don't have those yet, right?
No.
Okay, so I'm saying we're going to incorporate Andy's comments and without having actually seen the comments of the state's attorney, which I'm sure are fitting and proper and legal. That's my motion.
Thank you. In a second?
Oh.
Mrs. Polk? All right, thank you. And then, all in favor, say aye.
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 Pose, same sign. Any opposition on Zoom? None? Okay, thank you. That will pass, and then we'll get the full document at the full board meeting, and then we can make corrections there if we need to. The next thing listed in new business has been tabled per Mr. Rowe, so that will come back at next month's executive meeting. Do I have any old business? Do I have any old business come before this committee? Any other business? Mr. Hess?
Make a motion to adjourn.
Second by Mr. Payton. All in favor? Aye.